Jones, what's your name?
Hello, you're welcome. I'm Dr. Shehu Gandia here from Nigeria.
Hi. So, before we get started, I want to ask a few personal questions, if that's okay.
Okay.
So, what is your name? What is your age?
Okay, the patient, wai shekarunki nawa ne?
39.
Ishirin?
And
The patient's name is, the patient's age is 20 years.
20 years old.
She's
And
20 years.
what is her occupation?
Me aikinki. She's a petty trader.
Okay. And does she have any history of having an allergy to medicine?
Wai shin an san ki da akwai maganin da in kika sha yakan cutar da ke? She has no history of allergy.
Okay. So, what brings her in today?
You said?
What brings her in today? What is
Okay, okay. Wai me yake damun ki da kika zo asibiti? She came here with complaint of fever, headache, dizziness, and generalized body weakness. Kwana nawa kenan? For 2 days duration.
Okay. And how would she describe her fever? Is it on and off or is it continuous?
Wai ya zazzabin ne yake miki yakan je ya zo ne? Yes, the fever is on and off, intermittent.
Is it okay if you take her temperature and heart rate for me?
You said?
Her temperature and heart rate. Can you take her temperature and heart rate for me?
Yes, from our recordings with the thermometer, the temperature is 37 degrees centigrade.
Okay. So I'm suspecting that she has malaria. So for that, I'm going to ask if we could do a rapid diagnostic test.
Yes, that's beautiful. So if, just like you suggest the diagnosis to be malaria, it's beautiful. And when you run a rapid diagnostic test, if it is malaria, what did you expect to see?
Okay.
What did you expect the result to be?
I expect that she has a mild case of malaria.
So when you do a rapid diagnostic test, will the result be positive or negative?
Oh, positive.
Yes, yes, that's what I want. So it's good you mentioned you are going to run a rapid diagnostic test for malaria parasite and it will show a positive result. In addition, the result may indicate whether it's 1 plus, 2 plus, or 3 pluses. For simple malaria, you may get 1 or 2 pluses. So what other tests, apart from RDT, is there any other tests you may wish to do?
I also want to check for anemia. So can we do draw blood to test her hemoglobin levels?
Yes, that's beautiful. Still, for the malaria, you can also run a microscopy so that blood microscopy, when you do a blood smear, you can visualize underneath the microscope. You see the ova of the parasite or some parts of the body of the parasite, like the wing, which may suggest a malaria parasite, and your diagnosis be made. And also, just like you say, you'll also run tests to confirm if the patient has anemia, which is decrease in the number of blood cells. So if it's for only red blood cells you want to check, you can do what is called packed cell volume, that is the PCV. It will give you the percentage of the red blood cell that is decreased, and it will also show the hemoglobin level in gram per deciliter. And also you may wish to do a full blood count. If it is full blood count, it will show you both the number of red blood cell that is decreased causing anemia. It will also give you a picture of the white blood cell if the white blood cell is affected. If the white blood cell is affected, it will also be noticed within the full blood count. So by so doing, you will know whether there is sepsis or not. You find sepsis when there is the presence of actively dividing parasite in the bloodstream, and sepsis is usually found if there is complicated malaria. So it's good. It's good. So is there any other thing? How can you treat it?
So for treatment, we are going to do an ACT. And for anemia, we might want to do a little bit of iron supplements. And then for prevention in the future, we might want to hang up some mosquito netting and wear long sleeves and bug repellent.
Yes, that's beautiful. ACT, as you mentioned, artemisinin combination therapy is the first line treatment for malaria. Of course, it works beautiful when you give her, you find out that she's well. So with your prevention, we are all fine. You are good to be a doctor.
Thank you.
So I wish you become a doctor in the near future. You are welcome. Our doors are open. It's nice having you. Is there any other contribution you may wish to make?
No, I think I'm good. I hope you feel better.
Thank you. Thank you. Thank you. Yes, yes. Wai tana fata za ki samu lafiya. Yes, yes. She said thank you for wishing her well. I will give her all the necessary precautions as you mentioned on the preventive measures to prevent future occurrence. Thank you very much. It's been nice having you on board.
Thank you.